Professor Asghar Zaidi, Vice Chancellor, Government College, University Lahore, and Senior Research Fellow from Oxford Institute of Population Aging, UK, to please lead the discussion. Professor Asghar?
Thank you. Thank you. You can hear me fine, right?
Yes, sir. Yes, sir.
Thank you, Sana. You have done an excellent job. And it's not easy to find rigorous academic studies on such topics, because not only that you want to talk about social and cultural issues, you want to have their association with the mental disorder, you want to restrict yourself to working adults only, and then you want to linkage to the Sustainable Development Goals. So well done. That said, I thought it would have been great to have some kind of theoretical framework before you even do the first search. Just have few flow diagrams, few boxes, link them with arrows, and tell us what might be potential cultural and social aspects that can affect mental order, mental health. And then also give us a sense of how those challenges are covered in the most comprehensive policy framework of sustainable development that we ever had. I give you an example. When I started thinking about what you will be presenting and how I might go around making useful comments, I thought there are different sources of our social relations, our culture. One, as you rightly identified, arises from family, our relationship within the family, our norms within the family, which sometimes put our women at a disadvantage. And then you go beyond family to see where else, which other sectors where such cultural, social constraints can happen. And that could be opportunities in education, that could be opportunities in employment, that could be even opportunities of justice in judiciary. So you could think of multiple layers where the societal norms are affecting our mental order, mental health. So I would have liked to see that. You very rightly identified gender and especially women in their pregnancy. That's a challenging time for women in particular, but also for the whole family, especially when there is a first pregnancy, and then all kinds of norms and culture put the pregnant woman at a disadvantage, and as a result, she goes through all kinds of mental health issues. And also you identified one of the most underprivileged segment of the society, the transgender. I wanted to just see more of it. Even if you can't get actual practices, there's so much more in the gray literature. Even if you can't find studies in Pakistan, I would have liked to see a theoretical framework, as I said, but also say similar studies in a comparable social cultural setting, say Islam dominated culture, give us this sense how our societal norms, cultural norms affect mental health. But all of that to give you some prompts that when you go to the next version of this work, you might find them useful. Thank you.
Thank you so much, Professor Asghar. I would now request Dr. Umair Hussain or Dr. Rashid Hussain to please lead the conversation. Dr. Rashid?
Can you hear me?
Yeah.
Yep. So I'm pleased to be able to speak towards the end of these presentations, because A, it gives me the chance to wake up, and B, I get to really look at the themes that we're running through all of these presentations. And, you know, from my perspective, the whole objective of this working group is to try and inform the national mental health policy. So I saw a couple of themes running through, and I was hoping that we could use this to kind of crystallize some of the ways that we could take forward the work on the national mental health policy. And one of the main themes I think all of us have identified is the issues related to gender and mental health, particularly women's mental health. I mean, we've seen that and we focused on that in our work with PIL, but I think now it's about translating that into a national mental health policy. In Canada and in North America, it's very well recognized that women's mental health is underfunded in research, and it's also there aren't enough specialist mental health services. There's a need to improve access. I think that the situation in Pakistan is also obviously you know, it's biased against women and access to care, not just mental health care. So I'm wondering, as a nation, do we need to develop a policy? You know, we don't, I mean, speaking about little projects like workshops and so on and so forth, these are good for on the ground research, but like broadly speaking, as a country, do we need to develop you know, a point in our mental health policy that is you know, specifically aimed at improving the quality of mental health for you know, female citizens? Do we need to have, you know, does the government need to say, we are going to fund more research, we are going to fund you know, more services? So so that's just one thing that I've noticed. And of course, the other point that I noticed was this broader issue, societal issue of socioeconomic deprivation and how that's a determinant of mental health. Again, we know that in other settings, but does the national mental health policy need to align with that as well in some way? So these are the two themes that I saw emerging from all the presentations. I don't know if others found the same, and if there's anything else that we can talk about as a group that, you know, that can inform the national policies is what I'm talking about, rather than more the micro. Let's talk about the macro.
And can I just add something to that point? I agree that the themes that are running through are that women are disproportionately affected by a number of these psychosocial factors that we're talking about, and there are cultural determinants to that as well. So although this is preliminary data, I guess what we're finding is within this forum we can prioritize certain aspects of the policy that is already jumping out from all of the literature that we're looking at. When you've got limited resources, I suppose you have to use those judiciously. If women throughout the life course are vulnerable in a country and make up, I think, more than 50% of the population, that should be a priority component of the policy. Now, where does that start? I think that education in itself is an intervention. There are so many themes that are running through related to disproportionate representation in, whether that's in public sector, whether that's in academic settings, and within political spheres as well. I think equal representation is important, but where would that begin? I think that throughout the life course, preconception education is incredibly important, and I think that education about equality and equal representation needs to continue throughout that life course, and I think that should be prioritized as one of the first and foremost interventions to start to tackle some of these social injustices that are existing, and that really needs to be one of the priorities, because that theme is already very much there, and I think the next steps should be, as Dr. Ishit said, crystallizing what information we have, and then starting to inform the steps moving forward of how do we use the limited amount of time and resources to start to address these psychosocial determinants to ill health and probably mortality. I think it's really alarming that women are so vulnerable in a country of 220 million. I mean, if that's 110 million people, I think that's devastating. So that's something that that really speaks to me.
Thank you very much, Omar. That's very helpful. So just for people to know, so we are already into, as a part of this discussion, so we're already into all this is about how the way forward. And thanks to Professor Rasa, we actually, from his closing statements, we had embarked on the journey of way forward. Can I, at this stage, request Professor Lubna Baig, who's very much there, if she would like to comment on what's gone on for so far. If Dr. Professor Lubna, you can hear me?
Yes, of course, I can hear you, and I've been hearing for the last 2 hours, and I was putting in my comments, and the reason I did not speak up was because most of you were saying, you know, wo wali baat na ke wo hi mere dil mein tha. So most of you were talking about all that. I'm working with police on a couple of different issues. So, you know, that was addressed, how police are so vulnerable. And I think that's another area we need to address. I think my major comment amongst all these and the theme emerging, which I felt was not adequately addressed, maybe I'm wrong, is that we need to identify ways or address systematically how to address the stigma, because the stigma that is attached to a female saying that I'm stressed versus a guy saying stress, there's a huge gap. There's a huge gap. You know, a boss can say, you know, I don't want to talk about it today. You know, it's okay. You guys know what I'm talking about. So that's something that has not been addressed. It's not been researched as well. And was giving me different ideas. That's an area that, being in public health, that's something we can address. Because my other study, which I just completed, was violence during the times of COVID. And what came out was that people were more stressed, and that led to more violence against healthcare providers. And that's something that, you know, like, and I know in my institution, I work with Professor Iqbal Afridi pretty closely. We're trying to address and trying to identify and talking to people about how to deal with that. So if in the future work, I think that's something that would be my contribution to the group, and that's something that I like to you know, kind of take forward from here. And I must say that was a great, so far it's been going great, and I learned so much from the reviews that these youngsters have done, and the way they were doing their scoping reviews, you know, and then they've put in a good effort. So, you know, kudos to all of you one more time.
Thank you very much, Professor Lubna, because that was the whole point. Is so the whole idea of this stage of our workshop is to be, so what is missing? What more do we need to do? That's exactly what you have done, to especially highlight the points that we've probably not emphasized as much on. Can I request?
Can I just add something?
Yeah.
And again, Professor Lubna has said that she'll be happy to lead on this. This is what we need. So very, very grateful for agreeing to kind of contribute and lead on something which we so importantly want. And that's what the point of the group is, that if people can identify areas within the group that they would be more interested in working, it will greatly help
And
us.
even name or provide, and also providers name nationally or internationally, that who can be part of this of the group for the global advisory group, so we can strengthen the work that we are doing. Remember, we still have time, but we want to bring in, like Professor Zaidi's contribution was brilliant, is streamlining processes, is how do we go about making things better. So that's absolutely correct. So if I may then, Dr. Amjad, if I can bring you into it, you mashallah be there for a while if you're able to would you like to say something? If you can hear me? Fine. Maybe so. Anybody else would like to add in at this time? Dr. Moti Ram.
Hello, sir. Thank you, sir.
You're welcome, Dr.
Thank you,
Moti Ram.
sir. You have given me. Thank you, sir. You have given me the opportunity to bring excellent discussion. I have very learned a lot, sir. I have learned a lot. Thank you. Thank you so much, sir.
Brilliant. Brilliant. Thank you very much. So,
welcome again, sir. Dr. Imtiaz Dogar.
Dr. Imtiaz, it's such a pleasure to have you here.
सर आपके पेपर में जैसे रिस्क फैक्टर्स की बात हुई है, like low level of job satisfaction, monthly income less than 36,000, insufficient time for family duty, are there many factors which you have discussed? Regarding preventive aspect working adults पे अगर हम बात करें तो there is something जिस पे हमें सबसे ज़्यादा emphasize करना चाहिए, that is technical and vocational training. इसमें गवर्नमेंट के इंस्टीट्यूट हैं लाइक नेवटेक एंड टेवटा है, इनके साथ में लिंकअप करके नॉट ओनली रिहेबिलिटेशन ऑफ साइकियाट्रिक पेशेंट्स में हेल्प कर सकते हैं, रादर प्रिवेंशन में, वर्किंग एडल्ट्स में, उनकी टाइम मैनेजमेंट में, उनकी इंपॉर्टेंस में, उनकी बुलिंग को सेव हो सकता है, उनका वर्क प्लेस एनवायरनमेंट बेहतर हो सकता है और एम्पावरमेंट मिल सकती है उन लोगों को अगर हम उनको टेक्निकली ट्रेन करें। तो उसको एक इम्पॉर्टेंट एस्पेक्ट बनाएं अपनी वे फॉरवर्ड में और अपनी इम्प्लीमेंटेशन में, a collaboration with that very institute.
Excellent.
शुरू किया प्राइम मिनिस्टर ने उसके साथ लिंक अप कर।
Absolutely brilliant. But that is a step, brings us a step closer to recovery. Absolutely brilliant.
I would add, I think Dr. Imtiaz has said very well. बस एक छोटा सा पॉइंट है इसमें, अगर हम मोहल्ले मदरसे के साथ जो होते हैं और मीडिया के लोग, ये तीन लोगों को भी इन्वॉल्व करें तो दे कैन bigger the actually project the whole system we want to tell to people, like हम जो justice चाहते हैं, social justice और जो psycho social education चाहते हैं, उसमें वो बहुत बड़ा part play कर सकते हैं।
अच्छा, आपने बहुत important point किया, because if you look at one of the slides, one of the themes that came out even in our discussion in Islamabad was that we need to bring in our imams, our faith healers, our spiritual leaders onto it. And in fact,
क्योंकि अगर हम जी रूरल सेटिंग में जाएं तो देख अब जो हमारे पास मेंबर्स आ रहे होते हैं या वन फाउंटेन हाउस में, वो 8-10 इमाम और पीर बाबों के पास से होके आ रहे होते हैं, एंड नेचुरली वी गो फॉर लाइक अगर हमने गाइडेंस लेनी है तो विल गो टू द टीचर या हमारे रिलीजियस मेंटोर या फिर हमारे अगेन जो आते हैं वालिदैन आते हैं, तो जो बड़े फिगर्स होते हैं हमें उन्हें इन्वॉल्व करना बहुत इम्पोर्टेंट है।
I agree. Share this. We actually, when we worked on mental health awareness in the UK, and if you remember, we worked with imams and we worked from the mosques, because you know what, we go to the source. So that's the key. I think we probably have 3 minutes left.
डॉक्टर इमरान, मैं कुछ ऐड करना चाहूँगा if possible. I'm Yar Mohammad Khan Niazi from Bannu.
Thank you very much. आपने contribute किया है in the chat as well. You're very kind.
सर मैं चूँकि IDPs की डिस्कशंस हो रही है, यूथ की डिस्कशंस हो रही है, मदारस की डिस्कशंस हो रही है, तो मैं उसका खुद विटनेस हूँ, I'm part of that. IDPs जब क्राइसिस थी तो उस वक्त जब उनकी माइग्रेशन स्टार्ट हुई थी तो हम ग्राउंड पे थे अल्हम्दुलिल्लाह, लास्ट डे तक इनकी रिहेबिलिटेशन तक हम ग्राउंड पे थे, हमने इनके साथ काम किया। एक चीज़ सर मैं थोड़ी सी मुझे गिल्टी फील हो रही है कि जब भी हम बात करते हैं कि इनको प्रिवेंट किया जाए या इनको वो किया जाए, सर हम उन लोगों से एक्सपेक्ट कर रहे हैं जो खुद मेंटल स्ट्रेस का शिकार हैं, तो वो कैसे किसी और को कर सकते हैं, बेहतर तरीके से ट्रीट कर सकते हैं। दूसरी चीज़ सर ये है कि जब तक हम चाइल्डहुड लेवल से ये चीज़ें हम नहीं लेके जाएंगे, पॉसिबल ही नहीं है। फॉर एग्जांपल हम टेम्पररी तौर पे हम पुलिस ऑफिसर्स को ट्रेनिंग दे सकते हैं कि आप वुमेन को ट्रीट करें। सब पुलिस ऑफिसर्स की जो अभी बात हुई इस डिस्कशन में, सेशन में, कि उनकी सैलरी कितनी है, अनएम्प्लॉयमेंट इतनी ज़्यादा है, एजुकेशन लेवल हम हर साल 1000 डिग्री होल्डर्स पैदा कर रहे हैं यूनिवर्सिटी से, उनका ना कोई स्टैंडर्ड है, उनको ना हम कोई स्किल दे रहे हैं। तो सर सारी चीज़ें मिक्स अप होके एक अनएम्प्लॉयमेंट सिचुएशन है। अगर आप सर सोशल मीडिया, क्योंकि मैं सोशल मीडिया को भी लीड कर रहा हूँ, PTI के सोशल मीडिया को, खबर पख्तूनख्वा में टेररिज्म यहाँ पे हुई है, उसने हमें बहुत ज़्यादा इफेक्ट किया है। बहुत सारे फैक्टर्स हैं, एक काइंड ऑफ होपलेस नेशन हम बनने जा रहे हैं। अब देखेंगे कोई अगर अच्छा काम कर रहा है तो उसको हम उसको नेगेटिविटी की तरफ हम लेके जा रहे हैं, पॉजिटिविटी है ही नहीं। तो सर जब तक चाइल्डहुड लेवल से कोई हम इनको एंगेज नहीं करेंगे, इनके लिए हमें शॉर्ट टर्म, मिड टर्म और लॉन्ग टर्म पॉलिसीज बनानी पड़ेंगी। तो इसी की बेस पर हम इनको कर सकते हैं। मैं आप लोगों की तरह ना तो साइंटिस्ट हूँ, ना साइकाट्रिस्ट हूँ, ना ही वो हूँ, लेकिन क्योंकि मैं ग्राउंड से हूँ, कम्युनिटी से हूँ, तो मैं ये फैक्टर मुझ पर खुद गुजरे हैं, तो मैं जानता हूँ कि क्या होता है कम्युनिटी में और हम इसको किस तरह एड्रेस कर सकते हैं। थैंक यू सो मच।
Thank you so much. I would like to now request Professor Nusrat Hussain in the last 1 minute to please address the audience for a thank you note, because we are just left with 1 more minute, sir.
Thank you very much. I would like to have more than a minute because it's important. I would start with thank you very much, all of you, but I would want to make a request here today. The task is so huge, ये bill cannot do it. It's not possible. तो हमारे पास है people like Professor Zaidi. We have got Professor Imtiaz. We have got Professor Lubna. We've got Professor Heather Naqvi, such resources, people like Yar Mohammed. अच्छा, एक academic side है, एक on the ground side है. हमें at this stage academic side से ज़्यादा support की ज़रूरत है. If you are able to suggest some people who are able to work with the core PIL team, क्योंकि हम जितना भी literature पढ़ें, हम नहीं कर सकते, और इसके लिए हमको चाहिए, हमने ऑलरेडी वी हैव गॉन थ्रू हाफ ऑफ द टाइम, हमारे 8-9 महीने गुजर गए, एंड दिस इज वेयर वी आर, और हमें बड़ी अपॉर्चुनिटी है टू बी एबल टू प्रेजेंट दिस टू द पार्लियामेंट। तो मेरी आप सब लोगों से रिक्वेस्ट है कि इफ यू कुड काइंडली, उन लोगों को हम एकेडमिकली सपोर्ट करेंगे, उनकी पब्लिकेशंस होंगी, बट वी नीड टू डू दैट कि ईच सेक्शन में अगर कोई स्मॉलर वर्किंग ग्रुप्स बन जाएं, who is able to take that forward. Thank you very much. Brilliant presentations. आप लोगों का बहुत बहुत शुक्रिया. Thank you very much and खुदा हाफिज.
Thank you everybody. Allah Hafiz.